today. So I have my barium bag, my barium, I have my gloves, towels, and I have some lube for the tip and the insertion. I have my hemostats for clamping the tubing, and I also have my cuff inflator, and this will inflate the balloon on the tip. And then I also have my air infuser. And then for my decubitus, I have my landscape grid. Okay, so now that I have my bag filled with barium and set about 24 inches above the table of the patient, I'm going to go ahead and lead my line. So that means I'm going to let barium run through the tube just before it gets to the double lumen tip. And I'm going to stop it there, and then I'm going to clamp it here. For extra protection, I could also place a hemostat on the tubing just so there is no leakage. We want to get as little air into the patient as possible for comfort. And then also at this point, I'm going to, again, check to make sure that the balloon will inflate with one pump. Make sure there's no holes or leakage. Okay, that looks like it's working well. And I'm going to go ahead and grab my patient. Hello, can I get your first and last name? Okay, and your date of birth? Perfect. Any chance of pregnancy today?
No.
Okay, and did this BE procedure get explained to you already?
Yes.
Okay, and did you do your overnight cleansing?
Oh, yes.
Okay, perfect.
Horrible.
It was successful?
Yes, sadly.
I'm going to give you this gown. You
Okay.
can go ahead and remove everything and have the opening in the back.
Okay.
At this point, I'm going to have my patient go ahead and lie on the table in an AP position. I'm going to do a KUB. I would have my technique 120 with a 20 mass, and that is going to be for my scalp. Okay, so I have my patient laying in the Sims position. I'm going to go ahead and place a little bit of lube on a paper towel. And then I'm just going to go ahead and put that lube on my double lumen tip to help with insertion. I'm going to just tell my patient to take a deep breath in and let it out and relax. I'm going to insert the tip 1 inch anteriorly and 3 inches superiorly. At this point, I'm going to go ahead and inflate the inflator cuff with one pump. We might see the tip move in slightly as the balloon locks into place. At which point, I'm going to go ahead and grab some tape. Oh. Before I grab some tape, I'm going to go ahead and clamp this, make sure that the air doesn't come out of the balloon. And then I'm going to tape the tube to my patient's leg. Okay, so at this point, the radiologist has already taken all the fluoro images, so we're going to go ahead and take the overheads. I'd place the barium bag on the table at this point. I have a shield. Since I have a female patient, I'm going to shield her breasts. If I had a male patient, I would shield below the symphysis, the pubic symphysis. My SID is 40 inches. This is the right lateral decubitus. SID is 40 inches. I'm going to center at the iliac crest and the mid-sagittal plane. I have a little bit of light above my patient and below my patient onto the mat. I'm going to mark this side that's up. So I'm going to be marking the left side. Okay, perfect. For this image, I'm going to use a technique of 120 at 25. Go ahead and take a deep breath in and let it out. Go ahead and hold your breath. X-ray. Go ahead and breathe and relax. For the next image, I'm going to do the right lateral rectum. For this one, I'm going to be detenting the table. And I'm going to remove my my lateral grid that I use for the decubitus. And I'm going to have my patient scoot a little bit towards me, please. Perfect. Have an SID of 40 inches. Down just a little bit. I'm going to go ahead and detent to the Bucky. go ahead and center at the as-is and the mid-coronal plane. And I'm going to place my right marker where I have a little bit of light showing. So I'm going to place that right in the front right here. Adjust my shields. I'm going to use a technique of 120 at 60. Go ahead and hold your breath. X-ray. Okay, now I'm going to have my patient turn in an RAO position. So if you can put your right arm behind you on the side.
Oh my goodness.
And then I'm going to have her bring her leg up, rotating her 35 to 45 degrees. I'm already detented to the Bucky, so I'm just going to move my patient. For this one, I'm centering at the iliac crest, and then I'm going to go 2 inches to the elevated side of the spine. About there. Lost my marker. And then I have a little bit of light in the back, so I'm going to go ahead and place my right marker back there. I'm going to re-shield my patient. I'm going to use the technique of 120 at 25. Go ahead and take a deep breath in and let it out. Hold your breath. X-ray. Go ahead and breathe and relax. Okay. Now if you can turn all the way onto your stomach. Yeah, got it. Okay, so now I'm going to again center at the crest. This time I'll be at the mid-sagittal plane. Just open up there. And then just I'm going to place my right marker to the bottom right corner of the light field. This one I'm going to use a technique of 120 at 20. Go ahead and take a deep breath in, let it out, hold your breath, X-ray. Go ahead and breathe and relax. Now I'm going to do my PA axial. I'm going to put an angle between 30 and 40 degrees caudad. I'm going to use 30 degrees. Okay. Move this forward. And I'm going to re-detent my Bucky and my tube. Okay. This one, my central ray is going to be exiting the as-is and again at the mid-sagittal plane. Okay. I'm going to keep my marker at the bottom right corner. Technique for this one is going to be 120 at about 32. Go and take a deep breath in, let it out, hold your breath, X-ray. Go ahead and breathe and relax. Now I'm going to take my angle off my tube. Going to re-detent my tube and my Bucky. Now I'm going to have my patient roll up slightly onto her left side, so I'm going to have her bring her left arm behind, and bring her leg out to kind of pop her up again, a 35 to 45 degree obliqueness. I'm going to center at the iliac crest and 2 inches to the elevated side of the spine. Okay, open up, re-shield my patient, and then I have a little bit of light in the back, so I'm going to go ahead and use my left marker. Use the technique of 120 at 25. Go ahead and take a deep breath in, let it out. Hold your breath, x-ray, go ahead and breathe and relax. And for the next one, I'm going to have my patient roll all the way up onto her left side. Going to place my grid back into this holder for my left lateral decubitus. Have my patient scoot as close as she can to the board and have her bring this arm front, right there. Have my SID back at 40 inches. There. We want the central ray to be at the iliac crest in the mid-sagittal plane. So that looks good there. Have a little bit of light above my patient and below my patient onto the mat. I'm going to mark this side that's up, so I'm going to be placing my right marker. I'm using my 14 by 17 grid. Replace my shield back on my patient. I'm going to use a technique of 120 at 25. Go ahead and take a deep breath in, let it out. X-ray, go ahead and breathe and relax. Okay, so the next image that we would take is the post-evac, and that was going to be another AP supine KUB. And that's it.